Question 1. A nurse is caring for a client with acute respiratory distress syndrome, or ARDS. Which finding indicates worsening condition? A. PaO2 of 72 millimeters mercury. B. Bilateral crackles. C. Refractory hypoxemia. D. Increased respiratory rate. Answer. C. Refractory hypoxemia. Rationale. ARDS is defined by hypoxemia that does not improve with oxygen therapy, indicating severe alveolar damage and shunting. Question 2. A client with COPD is receiving oxygen via nasal cannula at 4 liters per minute. Which finding requires immediate intervention? A. Oxygen saturation 91%. B. Drowsiness. C. Barrel chest. D. Productive cough. Answer. B. Drowsiness. Rationale. Excess oxygen can suppress the hypoxic drive in COPD, leading to CO2 retention and respiratory failure. Question 3. A nurse assesses a client with a pneumothorax. Which assessment finding is expected? A. Bilateral crackles. B. Tracheal deviation. C. Dullness to percussion. D. Increased tactile fremitus. Answer. B. Tracheal deviation. Rationale. Air in the pleural space causes lung collapse and mediastinal shift, especially in tension pneumothorax. Question 4. A client with asthma is unresponsive to initial bronchodilator therapy. What is the nurse's priority action? A. Administer oral steroids. B. Prepare for intubation. C. Encourage pursed lip breathing. D. Increase IV fluids. Answer. B. Prepare for intubation. Rationale. Failure to respond to bronchodilators indicates impending respiratory failure. Question 5. Which ABG finding is expected in early respiratory alkalosis? A. pH 7.30. B. PaCO2 30 millimeters mercury. C. HCO3 negative 18 milliequivalents per liter. D. PaO2 55 millimeters mercury. Answer. B. PaCO2 30 millimeters mercury. Rationale. Respiratory alkalosis results from hyperventilation, causing low carbon dioxide levels. Question 6. A nurse is caring for a client with tuberculosis. Which intervention is most important? A. Surgical mask for the client. B. N95 respirator for staff. C. Positive pressure room. D. Gloves only. Answer. B. N95 respirator for staff. Rationale. TB is airborne and requires airborne precautions, including N95 respirators. Question 7. A client has a chest tube for hemothorax. Which finding indicates proper function? A. Continuous bubbling in suction chamber. B. Tidling in the water seal chamber. C. Absence of drainage. D. Sudden increase in bubbling. Answer. B. Tidling in the water seal chamber. Rationale. Tidling reflects normal pressure changes during respiration. Question 8. Which client is at highest risk for developing ventilator-associated pneumonia, VAP? A. Client on BiPAP. B. Client intubated for 72 hours. C. Client using incentive spirometry. D. Client receiving oxygen by mask. Answer. B. Client intubated for 72 hours. Rationale. Endotracheal intubation bypasses natural defenses, increasing VAP risk. Question 9. A nurse assesses a client with pulmonary embolism. Which finding is most characteristic? A. Bradycardia. B. Sudden dyspnea. C. Productive cough. D. Wheezing. Answer. B. Sudden dyspnea. Rationale. Pulmonary embolism causes acute onset respiratory distress due to blocked pulmonary blood flow. Question 10. Which position best promotes lung expansion in a client with dyspnea? A. Supine. B. Prone. C. High Fowler's. D. Trendelenburg. Answer. C. High Fowler's. Rationale. Upright positioning allows maximum chest expansion and improved ventilation. Question 11. A client with chronic bronchitis is expected to have which finding? A. Pink, thin appearance. B. Blue-tinged skin. C. Hyperventilation. D. Dry cough. Answer. B. Blue-tinged skin. Rationale. Chronic bronchitis causes hypoxemia, leading to cyanosis, blue bloater. Question 12. Which lab value is most concerning in a client with respiratory failure? A. PaCO2 52 mm mercury. B. PaO2 48 mm mercury. C. HCO3 negative 26 milliequivalents per liter. D. pH 7.36. Answer. B. PaO2 48 mm mercury. Rationale. Severe hypoxemia is the most immediate life-threatening abnormality. Question 13. A nurse suspects a tension pneumothorax. What is the priority intervention? A. Chest X-ray. B. Needle decompression. C. Oxygen via nasal cannula. D. Pain medication. Answer. B. Needle decompression. Rationale. Tension pneumothorax is a medical emergency requiring immediate decompression. Question 14. A client with pneumonia has crackles and fever. Which complication is the nurse monitoring for? A. Atelectasis. B. Sepsis. C. Asthma. D. Pulmonary edema. Answer. B. Sepsis. Rationale. Untreated pneumonia can progress to systemic infection and septic shock. Question 15. Which finding suggests respiratory acidosis? A. pH 7.48. B. PaCO2 60 mm mercury. C. HCO3 negative 18 milliequivalents per liter. D. PaO2 90 mm mercury. Answer. B. PaCO2 60 mm mercury. Rationale. Respiratory acidosis is caused by carbon dioxide retention. Question 16. A client with COPD is taught pursed lip breathing. What is the purpose? A. Increase oxygen intake. B. Decrease airway collapse. C. Reduce heart rate. D. Improve secretion clearance. Answer. B. Decrease airway collapse. Rationale. Pursed lip breathing prolongs exhalation and prevents airway collapse. Question 17. Which sign indicates worsening status asthmaticus? A. Loud wheezing. B. Productive cough. C. Silent chest. D. Tachycardia. Answer. C. Silent chest. Rationale. A silent chest indicates minimal air movement, a life-threatening sign. Question 18. A client with pleural effusion is expected to have which symptom? A. Hyperresonance. B. Dullness to percussion. C. Wheezing. D. Increased fremitus. Answer. B. Dullness to percussion. Rationale. Fluid in the pleural space produces dull percussion sounds. Question 21. A client is receiving mechanical ventilation. Which alarm requires immediate action? A. Low pressure alarm. B. High pressure alarm. C. Battery alarm. D. Humidifier alarm. Answer. A. Low pressure alarm. Rationale. Low pressure may indicate disconnection, risking acute hypoxia. Question 22. A nurse suspects atelectasis post-operatively. Which intervention is most effective? A. Deep breathing exercises. B. Antibiotics. C. Fluid restriction. D. Bronchodilators. Answer: A. Deep breathing exercises. Rationale: incentive spirometry and deep breathing re-expand alveoli. Question 23. A client with pulmonary edema is expected to have which symptom? A. Dry cough. B. Pink frothy sputum. C. Bradycardia. D. Clear lung sounds. Answer: B. Pink frothy sputum. Rationale: fluid leakage into alveoli produces pink frothy sputum. Question 24. Which condition places a client at highest risk for respiratory failure? A. Mild asthma. B. Kyphosis. C. Guillain-Barré syndrome. D. Seasonal allergies. Answer: C. Guillain-Barré syndrome. Rationale: neuromuscular disorders impair respiratory muscle function. Question 25. A nurse evaluates oxygen therapy effectiveness. Which finding shows improvement? A. Increased heart rate. B. Improved mental status. C. Elevated PaCO2. D. Decreased urine output. Answer: B. Improved mental status. Rationale: improved cerebral oxygenation enhances level of consciousness. Question 26. A client with lung cancer develops sudden dyspnea and hypotension. What is the priority concern? A. Pneumonia. B. Pulmonary embolism. C. Atelectasis. D. Bronchospasm. Answer: B. Pulmonary embolism. Rationale: cancer increases risk for hypercoagulability and emboli. Question 27. Which assessment finding suggests carbon monoxide poisoning? A. Cyanosis. B. Cherry red skin. C. Wheezing. D. Crackles. Answer: B. Cherry red skin. Rationale: carbon monoxide binds hemoglobin, producing characteristic skin coloration. Question 28. A client with emphysema is most likely to have which ABG result? A. Respiratory alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Normal ABGs. Answer: C. Respiratory acidosis. Rationale: emphysema causes chronic CO2 retention. Question 29. Which action best prevents post-operative pneumonia? A. Early ambulation. B. Pain medication. C. Fluid restriction. D. Bed rest. The answer is A. Early ambulation. Rationale: mobility promotes lung expansion and secretion clearance. Question 30. A nurse is caring for a client with respiratory failure. Which finding requires immediate intervention? A. Mild tachypnea. B. PaO2 50 mm mercury. C. Anxiety. D. Restlessness. The answer is B. PaO2 50 mm mercury. Rationale: severe hypoxemia threatens tissue oxygenation and survival. Question 31. Which sign indicates effective airway clearance? A. Diminished breath sounds. B. Clear lung sounds. C. Increased work of breathing. D. Cyanosis. The answer is B. Clear lung sounds. Rationale: clear sounds reflect open airways and effective secretion removal. Question 32. A client with a tracheostomy suddenly has difficulty breathing. What is the nurse's first action? A. Suction the tracheostomy. B. Call the provider. C. Apply oxygen, D. Obtain vital signs. The answer is A. Suction the tracheostomy. Rationale: mucus plugs are common and cause acute airway obstruction. Question 33. Which condition causes a ventilation-perfusion mismatch? A. Asthma, B. Pulmonary embolism, C. Bronchitis, D. Pneumonia. The answer is B. Pulmonary embolism. Rationale: perfusion is blocked while ventilation remains intact. Question 34. A nurse notes use of accessory muscles in a client. What does this indicate? A. Normal breathing, B. Improved oxygenation, C. Increased work of breathing, D. Airway obstruction resolved. The answer is C. Increased work of breathing. Rationale: accessory muscle use indicates respiratory distress. Question 35. Which medication is first line for acute asthma exacerbation? A. Corticosteroids, B. Short-acting beta agonists, C. Anticholinergics, D. Leukotriene modifiers. The answer is B. Short-acting beta agonists. Rationale: SABAs rapidly relieve bronchoconstriction. Question 36. A client with pneumonia has low oxygen saturation despite oxygen therapy. What is the likely cause? A. Hypoventilation, B. Shunting, C. Hyperventilation, D. Anxiety. The correct answer is B. Shunting. Fluid-filled alveoli prevent oxygen exchange despite oxygen delivery. Question 37. Which assessment finding is an early sign of hypoxia? A. Cyanosis, B. Bradycardia, C. Restlessness, D. Hypotension. The correct answer is C. Restlessness. Neurologic changes occur before late physical signs. Question 38. A client has paradoxical chest movement after trauma. What does this indicate? A. Pneumonia, B. Flail chest, C. Pulmonary embolism, D. Hemothorax. The correct answer is B. Flail chest. Rib fractures cause independent chest wall movement. Question 39. Which oxygen delivery device provides the highest FiO2? A. Nasal cannula, B. Simple face mask, C. Venturi mask, D. Non-rebreather mask. The correct answer is D. Non-rebreather mask. Non-rebreathers deliver up to 95 to 100% oxygen. Question 40. A client with lung abscess is cared for. Which symptom is expected? A. Dry cough, B. Foul-smelling sputum, C. Wheezing, D. Hemoptysis only. The correct answer is B. Foul-smelling sputum. Anaerobic infection produces malodorous sputum. Question 41. Which finding indicates respiratory muscle fatigue? A. Tachypnea, B. Decreased respiratory rate, C. Loud wheezing, D. Increased oxygen saturation. The correct answer is B. Decreased respiratory rate. A slowing rate signals muscle exhaustion and impending failure. Question 42. A client with ARDS is placed in prone position. What is the rationale? A. Reduce secretions, B. Improve ventilation perfusion, C. Decrease oxygen demand, D. Prevent aspiration. The correct answer is B. Improve ventilation perfusion. Proning improves alveolar recruitment and oxygenation. Question 43. Which finding suggests cor pulmonale? A. Crackles, B. Jugular vein distension, C. Fever, D. Hemoptysis. Answer: B. Jugular vein distension. Rationale: right-sided heart failure causes systemic venous congestion. Question 44. A nurse is suctioning an intubated client. Which action prevents hypoxia? A. Limit suction to 10 seconds. B. Increase suction pressure. C. Suction continuously. D. Avoid pre-oxygenation. Answer. A. Limit suction to 10 seconds. Rationale. Prolonged suction removes oxygen, causing hypoxia. Question 45. Which sign indicates effective treatment of pneumonia? A. Increased WBC count. B. Improved oxygen saturation. C. Persistent crackles. D. Fever spikes. Answer. B. Improved oxygen saturation. Rationale. Improved gas exchange reflects resolution of infection. Question 46. A client with severe kyphoscoliosis is at risk for which condition? A. Asthma. B. Restrictive lung disease. C. Obstructive lung disease. D. Pulmonary embolism. Answer. B. Restrictive lung disease. Rationale. Chest wall deformities limit lung expansion. Question 47. An intervention is most effective in preventing hypostatic pneumonia. A. Turning every 2 hours. B. Pain medication. C. Oxygen therapy. D. Fluid restriction. Answer. A. Turning every 2 hours. Rationale. Frequent repositioning prevents secretion pooling. Question 48. A nurse assesses a client with inspiratory stridor. What does this indicate? A. Lower airway obstruction. B. Upper airway obstruction. C. Fluid overload. D. Bronchospasm. Answer. B. Upper airway obstruction. Rationale. Stridor is a high-pitched inspiratory sound from narrowed upper airway. Question 49. Which finding suggests acute respiratory failure? A. PaCO2 45 mm mercury. B. PaO2 58 mm mercury. C. pH 7.40. D. HCO3 minus 24 MEq per liter. Answer. B. PaO2 58 mm mercury. Rationale. PaO2 less than 60 mm mercury defines respiratory failure. Question 50. A nurse is caring for a client with increased intracranial pressure. Which finding is most concerning? A. Headache. B. Restlessness. C. Bradycardia. D. Nausea. Answer. C. Bradycardia. Rationale. Bradycardia is part of Cushing's triad, signaling impending brain herniation. You just worked through 50 high-yield respiratory NCLEX questions, and if this felt challenging, that's a good sign, because NCLEX doesn't reward comfort, it rewards clinical judgment. If this video helped sharpen your thinking, like, subscribe, and turn on notifications so you don't miss our next NCLEX deep dive. Drop a comment below and tell me, which question almost tricked you? Keep practicing. Keep thinking like a nurse. And remember, NCLEX doesn't test what you know, it tests how you think. I'll see you in the next video on MCQs Master 101.